Hello, I'm Michael Lineman,
And I'm Jonathan Rentler.
and today we are excited to be on our third episode of our Graduate Project mini-series podcast. Our graduate project, the title is The Effects of the Pandemic Lockdowns on the Psychosocial Health of Children in the United States. And today we have the pleasure of being joined by Dr. Elizabeth Steinberg. She graduated from medical school, St. George's School of Medicine Bayshore in 2012, completing her residency program at SUNY Downstate Medical Center in 2015. And currently, Dr. Steinberg is employed at Total Pediatric Care here in South Florida. Dr. Steinberg, thank you again for joining us today. We really appreciate it. How are you doing today?
Great. Thank you for having me.
Oh, it's such a pleasure, and we're very excited by this.
Absolutely. And in our exchange, you said that you loved OT. So what's your relationship with occupational therapy?
Personally, professionally, I'm a huge fan of occupational therapy, whether it's fine motor or like hand coordination, but it's so much more than that. It's really focusing on the entire nervous system, whether the child is anxious or needs help with their sensory system, attention issues. It's a wonderful therapy. It's one of my favorite therapies for referrals. Most parents know very straightforward speech therapy, physical therapy. They really don't understand the importance of occupational therapy. So I always add it when I'm doing a referral for those. I usually refer it through the state, or sometimes the school is able to offer it. And they sometimes, if a family has extra funds, will do it privately. It's always a fun therapy. They're usually in a gym. Sometimes they come to the school. It's a wonderful gift to be able to give your child occupational therapy.
Yeah, absolutely. We couldn't agree more.
Thanks for
And
being such an advocate
yeah,
for us.
really appreciate.
Sincerely.
Yeah, not everybody's familiar with occupational therapy, so it's nice to hear, from outside perspectives what it is, and it's great to hear that it's implemented, and we'd love to.
Right.
So, as I mentioned earlier, our graduate project is on the COVID-19 pandemics and the effects of the psychosocial health of children. And I was curious, there seemed to be an increase in BMI due to the sedentary lifestyle changes and a lack of psychosocial participation. What were the trends in childhood BMI and lifestyle changes? What were they like before the COVID pandemic lockdowns? What were you seeing in that?
So even before the COVID pandemic lockdowns, there was a increase in childhood BMI and sedentary lifestyle. And the increase is definitely something that I pay attention to in my practice, where the goal being never to create a stigma with the child, and especially making it not just the child, but really the whole family. Most times with children, they're getting taller. So the focus really is BMI, body mass index, where you're calculating the height and the weight. So I pay attention to that, the fact that the child is going to get taller. So we don't need to put the child on a diet like day one, that we're going to take baby steps, and we're going to focus on lifestyle changes. And it's going to, again, be a family effort. We're going to drink more water and take away the junk food, take away the snacking, take away the juice, make small lifestyle changes in the entire family. And we're all going to feel better. And as the child may maybe maintain the same weight, not gaining weight, they're going to get taller, and their BMI is going to get the opportunity to get to a healthy BMI. The desire to want to eat and the sedentary lifestyle is a vicious cycle. So the earlier we start to stop that vicious cycle, the better we are. And it's going to help the child now, but it's also going to prevent diseases later in life, such as diabetes, chronic heart disease, and also stress. So it's so important to detect these things early in that pediatric visit.
And I'm a firm believer that you're a product of your environment. Essentially, the people you surround yourself with, you could end up like them. And it was really interesting that you mentioned about the family making changes essentially as well. One thing about me is I love Cheez-Its and I love cookies and ice cream and all that stuff. But if I have a kid and my kid perhaps also is in the same kitchen as me, well, maybe it's not so good that they eat the Cheez-Its, the cookies, and the ice cream. So I was wondering if you could speak a little bit of how much of an effect does the family actually have on the pediatric population and their kids when it comes to the BMI and the sedentary lifestyle?
I think it's so important for food, but also diseases and habits. Again, it goes back to the stigma. We don't want to make anybody feel bad about their habits, but little by little, we kind of just steer them in the right direction, and then again, we will little by little. Critique that. So you can have all those things. So all of those things make life fun and they're treats. And little by little, I don't believe in taking away everything, because you'll do fine for a month and then you're going to bounce right back to the beginning. So have the Cheez-Its and ice cream, but just maybe not on the same day.
Understood. Understood.
All right, so you mentioned those trends before the lockdowns. While you were, while you were practicing during the lockdowns, did you notice like sort of lifestyle changes or an increase in BMI even in your patients during the lockdowns?
So during the lockdowns, in my particular practice, I really didn't have that many patients. I was in a outpatient clinic. Most kids were not coming in for their well checks. They were not coming in for vaccines. They were not getting sick. They were not there. No pediatric patients. Most COVID mostly affected adults, and kids were living in bubbles. They weren't as sick, thank goodness, as the adult population was. So I really didn't have that many patients during the pandemic era, but when they came back to practice, they that's when I saw them. And those were the effects of the BMI that I saw again. So I don't think they increased, but they just kind of maintained on the curve where they were just still up there. It's just been ongoing since the beginning. They're just still floating above the curve, a lot of these kids.
While maybe they're floating above the curve, do you see projections by 2025, 2030, 2035? Do you continue to see an increase in sedentary lifestyle and BMI, perhaps them being during the COVID-19 lockdowns, looking at their phones so much, watching Netflix, things of that nature? Are we going to see long-term consequences of that due to the COVID-19 lockdowns?
I think 4 years later, we're starting to not see as many effects from COVID. I think we're kind of COVID is now becoming more so much of like a not so distant memory. I don't know if we can really attribute so much to COVID 4 years later, because now other things are playing into effect, and I'm seeing a lot of referrals for other things. But social media for sure is a huge problem that I'm seeing with adolescents, tweens, like pre-adolescents, where, and then also the parenting is not really taking a big stance against it. Some are, but phone usage is a huge thing, especially with the sudden beginning of phones, where you don't have a phone and then all of a sudden you have a phone, and then there's no like rules. There's no proper phone etiquette. Healthychildren.org is a website. AAP the American Academy of Pediatric has great resources that I usually go to for recommendations for these type of questions, because they're usually filtered parenting advice for these types of questions.
Yeah, and maybe while you can find parenting advice there, I'm curious why. I mean, I have my own opinions about this because phones can be useful in a sense because you can follow in social media. Perhaps you can follow positive social media influencers and things like that that could help you live a healthy lifestyle. But also conversely, if you spend so much time on social media, it can detrimentally affect your health. I was curious, what are your opinions about the pediatric population being on their phones with social media, and how does that affect the sedentary lifestyle?
So I think with anything, again, when pediatrics is a fun, beautiful um, practice of medicine where a lot of the medicine overlaps with the parenting. So when the parenting and the medicine overlap, we I have to be very careful with how it becomes a cross to the parent, because my audience, the parents, I have to be very careful with what they want to hear from me. I have to make sure my facts are being clear and my advice is separated from my own advice, and that what their advice is what they want to give to their kids. But my personal advice is that you should have these discussions with your kids, your personal values, your values in your home. Kindness matters, because your kid's going to be looking at you for what to say out in the world, and they're going to go and say it. They're listening to everything in your house. So whatever you're doing, they're going to be doing. Whatever you're eating, they're eating. So a lot of these things are in your household and they're going out into the world. So you do have to have these conversations with your kids. If you give your kid a phone, you should be having these conversations with your children when you're giving your kid your phone, what you're allowed to watch. If you are watching something with that special kind of content, you could have blocks, but they're going to see it. So you should be ready to have these conversations with them when you're giving them access to a phone.
Yeah, I think it's very important, even for us as adults, to remember the content we consume creates the actions that we go out in the world with. And so just to kind of circle back, so you mentioned that during the COVID lockdowns, you worked at an outpatient clinic. Did you or any of your like colleagues switch to telehealth when it came to pediatrics during that time?
Yeah, so we did see patients in the clinic with masks and gowns. Telehealth for peds did exist. It still does, but there was funding from the government, and if you weren't doing telehealth pre-COVID, you were definitely doing it in COVID. So we did phone calls with telehealth. And then we would do encounters through telehealth. Yes. What I found most interesting with pediatrics was a lot of the evaluations were done for like speech and autism. Those were also done through telehealth, which was fascinating to me, because that almost seemed impossible. So a lot of things in pediatrics were done via telehealth that I thought would never be able to would happen, but that was happening.
And you also mentioned like most of the kids, like they were actually healthier during the pandemic because they weren't surrounded by so many people and they weren't getting sick and stuff because it was mostly an adult uh, disease. But so like as soon as the lockdowns ended, did you see like any specific trends in the children that you saw, like whether it was about sedentary lifestyle or like you mentioned the BMI just kind of like flatlined? It didn't necessarily increase, but it stayed relatively the same level.
I think what was very sad with a lot of the children was there was no extracurricular activity options. And then when I say flatlined, the BMI was still way above the curve, flatlining, just floating around above the curve. But there was no dance after school. There was no organized sports available. All of those activities were not available, and I think that was very sad. And a lot of parenting groups would kind of form their own, but the school wasn't offering them. A lot of kids were not in school, so that was, and I kind of, I don't know if that answered your question, but oh, the sedentary lifestyle. So the kids were, if they were going to school, they were going, but they weren't doing anything extra. So yes, the sedentary lifestyle was kind of going back to that.
Yeah, and I know that we talked about earlier just different advice that you give to caregivers, parents, families, and the children, through the social media, diet, different things like that. But is there any other advice that you would give to perhaps, while it's flatlined, but still obviously rising in the United States, and worldwide, the rates of obesity? Is there any advice that you would give to help try to decrease some of these effects?
Of the decrease the effects of gaining weight, or
Well, the increased BMI in the United States.
I think the most important thing is mindfulness. When I see a kid and their family come in, and I notice that they gained 20 pounds over the last year, that's very alarming to me. So I kind of calculate with them, if they're, let's say they're 15 and they gained 20 pounds in the last year, I'm only going to be with them until they're 18. Maybe I'll be with them until they're 21. If they gain 20 pounds for the next 5 years with me, what does that weight look like? And then we calculate that together. And that's a very interesting mindfulness activity. It kind of crosses a lot of disciplines. It's arithmetic, it's meditation, because we're sitting in the room together, we're spending time together, we're doing breathing exercises. We're in that room for a good 5 minutes doing this exercise. And it's very thoughtful. That's a lot of weight. Doing the same thing that they're doing, eating the same activities they're eating. So what can they do to change gaining 20 pounds next year? So we make a plan. Okay, I'm going to not drink this drink. That'll be the first step. So I love mindfulness. I think it's a great activity. It's very easy. You don't have to do anything. Sedentary lifestyle that they already do. And that probably is my first baby step towards the stabilizing the weight. And if they could at least stabilize the weight at the next visit, we've done something.
And John and I are both very big fans of mindfulness
Yeah.
training as well, routines, agendas, and thankfully that's something that occupational therapy does a lot of as
Yes.
well. So we're
Yes.
absolutely huge fans of that. Agendas, planning, helping to develop a routine is something big in occupational therapy. Also, what occupational therapy can do is help with medicine management. So helping schedule your day. I mean, there's the pill containers, making sure everything, the setting alarms, making sure medication is taken. I'm curious, in the pediatric population, it differs case by case. But how do you feel about certain medications, or do you tend to shy away from that and focus more as of a holistic approach? What's your thoughts on that?
Some kids actually do qualify for medications, they qualify for surgeries, which is alarming. Even young teenagers. We work with hospitals. We work with bariatric surgery. I do it all. I will do holistic. I will do surgical. I will do medicines. Again, am a physician. I am a medical doctor. So I do what the family wants. That's always been my practice. Help you, help your child. So it I see so many patients, so it is what works best for the family. It's not a one all approach.
Sure, that makes sense. Dr. Steinberg, we're going to be wrapping up here pretty soon. I wanted to thank you again for speaking with us. One of my final questions is, our fellow classmates who will hopefully be graduating, as long as everyone passes their finals, will be viewing this. And I was wondering if you had any parting messages, perhaps, to the future occupational therapists and the kind of impact that they can have on the pediatric population.
Um, Lots, know your patients, know your parents. Listen to parents. Definitely listen to parents. They are your eyes and ears. I think that's the most important thing for pediatrics is you are so lucky you have an advocate with you, and they know you're with them for one session, and they're with them for the rest of the day, the rest of the week. So they are your eyes and ears, and you're the little scientist, and they're the parents. So trust your parents if they're concerned. Trust their concern. Never undermine them. You're very lucky to be working with them, and it's an honor to work with children. So it's very special.
I think it doesn't matter if you're a pediatrician, an occupational therapist, or any other healthcare provider, you can impact the lives of your patients. And I think, especially in the pediatric population, it's so impactful to see the kind of impact you can make that can carry with them the rest of their lives. So, again, Dr. Steinberg, thank you so much for giving us your time today. We really
Thank you.
appreciate it, and we hope you have a good
Wonderful.
rest of your day.
Yes, anytime. Thank you so much for having me.